Well, welcome everybody who has logged in tonight to hear our fantastic informational webinar that we're doing with Dr. Grabiak from Denver Dentistry and his fantastic team. I can say that I have personally seen him, and I've sent both my parents over there, and I sent a lot of patients over to him because I know that he is going to take care of your dental health in the right way. And as we know, if you've listened to anything that I do or been a patient of mine, you know that I do advocate for dental health and how much it actually does affect your physical health, physical well-being. And he's going to do, I think, a fantastic job and touching on that for you tonight and giving you lots of information you can take away about your health and your dental health this evening. So I would like to introduce Dr. Grabiak, and he's going to give you a little synopsis, a little information about himself and how he got into holistic dentistry.
Well, thank you so much, Leah. We're really honored to be here because we're very passionate about what we do. And I think we're doing things at one of the best levels in all of Colorado and maybe even further than that. So we're pleased to be here. And I want to make sure I introduce Angelina. We work together on every single patient, and she's super special because she's a nerd. Okay, things that
I could confer that actually. Angelina, you do have like a very, very wealth of knowledge, and you're not just a dental hygienist by any means. I think we need to come up with a better title for you.
So in the state of Colorado, there's only 6 certified holistic hygienists, and she's one of them. So I'm so lucky to have her. I can't, every day is the best. Okay, it's like I have the best hygienist in like 40 years of doing this. So
we are really a good team. I mean, you get the best of both worlds, the perio side and the dental side, play well together.
So I do want to talk a little bit of myself and how I got involved in holistic dentistry or functional medicine per se. I went to the University of Pittsburgh, and then directly I spent 10 years in the United States Air Force. And there's a lot of really smart dentists there, but they did mercury fillings, and I was expected to do that. And I learned everything that they had to say about it. And I went to tremendous amounts of continuing education at the Air Force. I have a fellowship in the American Academy of General Dentistry. And so more than 2,000 hours of continuing education outside of dental school. But as soon as I got into private practice, that was the last time I placed a mercury filling. And I,
Video was on. What happened?
and then over time, I started to reach out and see what the Europeans were doing, and they were not placing your metals in the mouth, and they were also developing techniques to minimize exposure to the mercury. So I developed my own techniques, and my background is in kinesiology, so I've always loved the body and understand the body at a pretty high level. And so eventually I got involved in holistic organizations, and it turns out that they were doing many of the mercury removal techniques the same as mine. So we're one of the few dentists in the state that is certified to remove mercury fillings safely. Okay, and it's not just a matter of taking it out and exposing the patient more and more, getting it out safely. So so anyway, we've just kind of gradually progressed from a perspective of as we joined holistic organizations, we made decisions that they were really doing the right way to do things. And it just seems like a lot of the dentists, my colleagues, are not open-minded to accept other opinions. And so we eventually started coming up with different things for the practice, like ozone therapies and getting rid of fluoride, and then doing a lot of testing now. So we're one of the few practices in the state that does a lot of testing, and we can go into that a little bit.
Yeah, we can talk about now what makes our office different from what is holistic dentistry and what is traditional dentistry. Our mission statement, we do have we like to say bespoke demo services, and that's because we really do look at you as an individual, not just what our protocols are. And part of our new patient appointment is a consultation where the patient and Dr. Grabiak sit down and talk about all your concerns, all of your health issues, what you're wanting, what your goals are for your mouth, and hopefully we can do that, reach those goals in a way that's safe and will provide a good long-term result. So some of the things that Dr. Grabiak mentioned that traditional dentistry does is, fluoride. Every patient gets fluoride. They all get mercury fillings. It's a one-size-fits-all approach, and it's reactive treatment. A lot of times they're saying, let's just watch this spot until it gets worse, and then we'll
do a root canal and a crown.
Sounds very familiar to what I run into in conventional medicine.
Yeah.
I think that's why we like each other.
Yeah, we like to take a proactive approach. We're very heavy on preventative care. We're also looking comprehensively. Whatever we do in the mouth just doesn't stay in the mouth. It's going to affect our whole system. So we want to keep that in mind when we're making our treatment plan, that maybe it's a little bit of gingivitis. If there's a little bit of inflammation in your mouth, there's probably inflammation everywhere else.
The rest of the body.
So we do take that quite, into account when we're making a treatment plan. We do lots of biocompatibility. There's never a one size fits all. There's some people that are very sensitive to different materials that we might use. So we do a lot of different testing for that. We also, like Dr. Grabiak said, offer a variety of natural therapies, ozones, probiotic therapies, lasers. We have a few different lasers in the office that we use for different reasons. And a lot of our patients that come to us have very complex medical needs. And so a lot of their treatment is kind of heavy on the front end. But if we can get them nice and stabilized, get them to a healthy state, stabilize them, and then focus on preventive care, hopefully that will last throughout their lifetime. And we don't have to go back, and we're not always doing fillings or recommending a lot of treatment.
We're not here to hook you and keep you our patient forever, right? We want to get you well so that you can send us somebody else and not keep paying us, right?
Well, our patient base is a lot of people that have complex histories, but on the other hand, there's a good segment that's people that are really healthy and they want the best way to stay healthy. And then there's another segment that's a little bit different, and maybe I call them woo-woos. And so they believe in crystals and whatnot. And the reality is they're still focusing on their health. And we're open-minded to anything if it makes sense, and we think we see good results from it.
Do you guys treat all ages, correct?
We do, or we're primarily an adult-driven practice, but we do airway management with kids. So if a kid, that's primarily what we're doing with children is airway management and help them develop.
We'll talk about it a little bit more down the road on a few other slides, but if we truly believe that if we start off young, then we don't have to fix some of these problems down the road. And by guiding their airway, that's a great way to prevent a lot of these issues that develop for adults.
Awesome. Thanks for clarifying that.
Yeah. So one of the things that Tree recommends is fluoride, and we don't recommend fluoride in this office. None of our materials have fluoride in them. We know that fluoride is not a nutrient that is needed for any type of function in the body, including tooth health. It is a known neurotoxin, and it's linked to all sorts of issues, including Alzheimer's, cancer, diabetes, and so on.
Infertility, that's interesting because I don't think that's something that people think about when they're suffering from infertility, that fluoride could be a contributing factor.
Yeah, it sure is. What's interesting about fluoride too is traditional dentistry has been pushing fluoride for
Yep.
decades now. And well, maybe it has maybe slowed the decay decay risk and results. People are still getting tooth decay, and everybody's using a fluoridated toothpaste. There's fluoride in water. And so, if it really did fix all these issues, why are we still having these? There's more to tooth health than fluoride. And if we can replace it with something that's natural, that's non toxic, but will produce the same or better effect as fluoride, then that's our philosophy is let's use that.
Leah, when I was starting to go into holistic dentistry, at that point I had been giving fluoride to all of my patients. And one of the studies I found, there were two of them up in Canada that showed a 5-point reduction in your IQ level. Okay, so
Wow.
that's massive. And just for a kid that's got 100 as opposed to 105, that kid will make hundreds of thousands of dollars more throughout his life, just from that perspective. So
Yeah.
that's
And mercury lowers your IQ as well, right?
Yeah,
You got mercury fillings and you're flushing and drinking fluoride. So you've got a couple things causing your brain not to work right, just on the oral health side.
yeah, mercury is also a known neurotoxin. Traditional dentistry will tell you that mercury vapor is not released if there's no sort of heat or action on that tooth. This is a video of it's a person holding a tooth. It's not us, but you can see that the mercury vapor is coming off that tooth with no provocation. It's just there's that gas coming off of that tooth, and it's kind of scary because that is going on in our mouth all the time. And then if you think about people grind, clench, chew, there's it's constantly
acid erosion, just
galvanic reactions from different types of metals. If you have more than one type of metal in your mouth, gold.
I love this video. Interesting enough, I just did a talk with Dr. David Minkoff, who is a leading leader in the functional medicine world. And he was telling me, he said, if you spill mercury, you got to call the health department. They come in, they bring this Geiger counter, and they got to clean it up. You can't touch it. They've got full on body suits if it's over a certain parts per million. And he was like, if you take that same Geiger counter that they're using to test the mercury spill and put it in your mouth, it is with somebody who even has one dental filling, and you guys can probably confirm this, it is going to be just as high a reading inside the mouth as the spill on the floor.
Yeah, this is not like a secret. This information here, safety data sheet. This is the SDS-4 dental amalgam. If we look at those hazard identifications, it says very toxic, toxic by inhalation, may cause harm to unborn children and serious damage to health through prolonged exposure. And even if we continue, if we go on to that next, the NFPA rating, the health is a 4, which says deadly. And so there's no way that we would just pick up mercury and put it in our mouth, but yet they use it for fillings.
even the FDA, and they're very conservative in some of these areas because they're fighting lobbies. They don't recommend it for pregnant women, people that have autoimmune diseases, as well as nursing women. I guess it's okay for the rest of us. So
What is the average length of time that somebody typically has a mercury filling in their body?
average length, it could be 20, 30 years.
Yeah.
So I don't know if there's an average, but it depends on the tooth and the person and whatnot, but it can stay there for a long, long time.
We do want to get it out as soon as possible. And Dr. Grabiak was saying earlier, he does have a specific protocol that he uses to remove them safely. Do you want to talk about that a little bit?
Yeah, most dentists are not utilizing this protocol. This is something I developed on my own, and just because it made sense, it's just a good way to do dentistry. And it involves using a rubber dam, oxygen, 3 different types of ventilation systems, cutting the tooth into chunks rather than obliterating it. and then using special burrs and profoundly putting a lot of water on it or irrigation to keep the temperatures down. And then at the same time, we're doing a weak detoxification because it's mercury is so insidious, something's going to get through all of our protections. So it's a 10-step process plus the detoxification. And we're able to go at it, very effectively, quickly.
This looks great. I mean, I encourage people, and I think sometimes other non-holistic dentists will remove mercury fillings. And what I find is they protect themselves, but don't always protect the patient when they're removing the mercury fillings. And so that's one of the things that I try to educate my patients on in picking the correct type of dentist with the right certifications to remove these fillings.
So, Leah, it even goes a little bit further than that because we see this on a regular basis where the person says, yeah, I'll take the mercury filling out, whatnot, and then, or, well, I'm going to do a crown or whatever. And then they just leave the mercury and they put the crown on top of it. So that it's still in the mouth. They haven't gone through a safe way to get it out at all. And then then they put a crown on it and the mercury's still there. Because they just don't even see it as a remote possibility of a problem, even though it's a neurotoxin.
Yeah, I was going to say that earlier. You were talking, when you said, I kind of noticed different things, and that brought me into holistic dentistry and learning more about it. And I think that's part of medicine and dentistry is that we don't always know what we don't know. And if we're not seeking answers and broadening our knowledge, because the things that you do and I do, there's scientific literature out there that supports everything that we're talking about and what we do. We still practice that way as we've taught to do things that are supported in the literature. But often other people in conventional medicine and conventional dentistry just kind of are okay with what they were taught in school and don't always seek more knowledge, kind of learning these things that we're talking about and the complications and detriment to our patients' health that they do have.
Yeah, there's we always that I liked what you said there, that we don't know what we don't know until we are looking. And so we do offer heavy metal testing or mercury testing through Quicksilver Scientific as well. Because sometimes people just don't know, and we need it in order to measure how far we come. We need to know where we started. So.
Exactly. I 100% agree with that.
Mercury, but also the restoration. Dr. Grabiak does a really good job on minimally invasive dentistry, and so preserving as much of that natural tooth structure as possible. He uses a technique called BioClear.
So we do more small fillings than the general population because our goal is not to do crowns, not to do root canals. So we really try to get at a problem when we have to do it, and then use prevention for preventing the patient to have a reoccurrence of the problem. So it's all built on prevention as well as minimally invasive techniques how we utilize our dentistry.
Are you going to go into root canals here in a little bit? I don't want to jump ahead of your presentation.
We are.
I think that's our next
Okay.
slide.
Because I'd love people to hear why those are not necessarily the best option for you.
So a poorly performed root canal can cause many, many problems. Okay, chronic infections. There's basically areas in the tooth where bacteria can hide as well as mold and other pathogens. And so if a patient decides they want to get the tooth out because they don't want to deal with the potential problems, then we're going to do it.
So do you don't do root canals or don't advocate for them, correct?
A root canal can be done if it's under a certain techniques and certain guidelines, okay, use of laser therapy and whatnot. So I it's a tough situation because losing a tooth is a horrible thing. Okay, so the big thing is like preventing so you don't lose it. If we have to have it done, it can potentially done with laser techniques that can do a much better way of performing removal of bacteria as well as healing of the bone and whatnot. So there are some ways to do it safely, but there's very few in Colorado.
And then beyond that, what are kind of your option? What would be your next best option beyond that?
Well, when you have a tooth taken out, the best option is an implant. Okay, so and then the question is that's why we do biocompatibility testing. Is it going to be a ceramic implant or is it going to be a titanium implant? But bridges and whatnot are not good options. So the implant's the best way to go.
Awesome. Thank you for clarifying that.
We do like to, just to expand a little bit more, is Dr. Grabiak does go over all of the options for the patients, no matter what our opinion is. If a patient has a preference on what they want done to their tooth or their body, we're definitely open to listening to that and taking that into consideration when we're making our treatment plan, because ultimately the patient knows what they want to have done or not.
Yeah, they are the driver of their health. So I think our job a lot of times is just to educate people with the knowledge that we have to partake to them and help and allow them to make the best decision that they think is good for them. And there's a lot of considerations in that, right? It's not just your health or your dental health, it's also your pocketbook, unfortunately.
Yeah. That so for those patients, that just aren't sure or they have a lot of sensitivities, we do offer quite a few different tests, a lot of different biocompatibility tests. So there's thousands of dental materials out there on the market that we use for a variety of different procedures. And so we do offer biocompatibility through Biocomp Lab, ELISA, and MELISA testing for metal hypersensitivities and specific allergen testing. That way we can have a better comprehensive idea on what the patient needs and what we can safely, how we can safely treat them.
I love this because I do see a lot of hypersensitive patients, people who sometimes are eating like 4 foods and can't use any soap because they're so hypersensitive. So knowing that there's options for them to find out if they're going to have a reaction to something before we actually put it in their mouth, I think most of those people would be very grateful to have that kind of testing.
Yeah. Airway, we talked about that a little bit already. Airway's the root cause of a lot of systemic health issues, including grinding and clenching. That's probably one of the biggest questions that we get is, or evidence in the mouth that we see, people are presenting with flat teeth or TMJ problems or morning headaches. And they're like, I'm grinding or clenching, or sometimes they don't even know, but if we dig a little bit deeper, a lot of it goes to airway.
Yeah, airway's root of many, many evils throughout our systems. Okay, you've got to sleep good, and if you're not getting a good night's sleep, you're going to do things like clench your teeth and grind your teeth. And so we don't put anybody into a bite appliance for clenching or grinding until we do a sleep test on them. And so we go through a whole our examination on every single patient. We're just analyzing what their airway looks like and is the potential there that they're not getting a good night's sleep. If they're not getting a good night's sleep, it's going to impact their health in so many ways. So we're really big on that. We spend a lot of time on that, and it all starts when they're kids, and they're not, unfortunately, orthodontists are not paying attention to getting their teeth straight and not taking out or expanding their arch so the arch is bigger, the mouth, then the throat is bigger and they're getting more air. It's very, very simple.
And my understanding is that the orthodontics and the devices and braces to straighten the teeth so that everything looks pretty often can lead to other problems such as airway issues or TMJ and teeth grinding? Is that
The issues are going to last a lifetime. We saw a lady or a woman, young woman, 12 years old, young girl. She had her canine teeth taken out. That's the most important tooth in the mouth, the canine. Okay, everything has to go around it, and you take that out, she's basically handicapped for the rest of her life. So it just aesthetics, it's got to be form and function. Okay, the function has to follow the form. And so you've got to make the expansion first. You don't take teeth out. That's ridiculous. And so a lot of orthodontists are doing that.
awesome? I've come across, those mail order dentist braces that they can do now.
Yeah.
Like
Yep.
I've had patients come in who didn't have any like sleeping issues or grinding issues or anything, and then they got those mail order Invisalign braces, and now they have all those problems.
Yeah, don't do those.
Yeah, stay away from that.
I agree.
We do have quite a few options because a lot of times we would think that sleep apnea only affects big overweight men, but really it can affect anyone from small framed women to kids. It's the prevalence is really high, and a lot more people have it than sometimes we even realize. A lot of times we'll see the effects in the mouth and we'll kind of suspect it, and the person says, no, I don't sleep, or I sleep just fine. My husband doesn't say I'm snoring. And then we sleep test and we're like, wow, you're not getting any oxygen at night. So there's
it's dry, it dries the mouth out too, correct?
Oh, of course, yeah.
And then that's another added complication to what's going on besides the fact that we're not breathing.
Yeah,
Well,
definitely.
it changes the pathogens in the mouth that affect the rest of the body. So it changes the bacteria.
Yeah. Yeah, so dry mouth does affect that bacteria. It will cause the bacteria to grow, but also that low oxygen environment, those anaerobic bacteria just thrive in that. So that's another way we can keep the good microbiota growing, is it just increasing that oxygen. Those pathogens, those high-risk pathogens, the red complex pathogens, won't be able to survive if we just get more oxygen in there.
I think there's a lot of things that oxygen helps us with, right?
Yeah, that brings us to ozone.
So we use ozone on every single one of our patients. It's in our waters, it's in our water lines. We use it to desensitize teeth, treat periodontal disease, treat cavities as a tooth desensitizer. We have people that come in for infections. We're not really big on using antibiotics. So many times before and after an extraction, let's say a person's going to have an implant, we'll do ozone therapy on them. So it's just been a game changer for our practice, and we love it. We love it.
Yeah.
And I believe in ozone as well. And that's how we met. One of my ozone colleagues introduced me to you. So it's a great option for everything that you said on a lot of different levels.
Yeah, before we can even treat the pathogens, so we have to do some testing. So we do a lot of salivary testing in our office, from checking biomarkers that, different biomarkers that cause tooth decay to biomarkers that show us that there's some signs of inflammation in the gum health, in the periodontal health, to bacterial testing. We're doing DNA testing to check for genetic markers that increase your risk for periodontal disease and how your body responds to inflammation. If we get these baseline results, then it's not just subjective data where we're saying, yeah, you look better, or, maybe you had some improvement. We actually have the data to show that what we're doing, we're getting the results. This is one of the salivary tests that we do. We do the HR5 testing. All these 5 bacteria are all directly associated with gingivitis and periodontal disease. Probably what's more important is they're also associated with other inflammatory diseases like cardiovascular disease, diabetes, cognitive decline, pregnancy complications, things like that. So these are really important. If you have these bacteria, if you don't do anything about it, we know that you're going to potentially lose your teeth down the road, but also you're at a higher risk to develop these other inflammatory diseases.
So thus shortening your lifespan and just your overall health and wellness.
Yeah.
You know, Leah, the really cool thing about this HR5 test, and we do it on all of our new patients because it's just so darn important. The reality is, most of our patients are not going to lose their teeth. They'll lose some of their teeth, or maybe if they don't do anything. Okay, it's they've been going to the dentist. They get it. We need to go every 6 months and whatnot. But they're going to have problems that are systematic if you don't identify these pathogens, and other dentists are not doing this. So losing a tooth is one thing. Having a stroke is something a lot more significant, or having dementia at an early age. So those are treatable diseases if we catch them and we take the steps.
I agree. And I find that those doctors who are treating, who are specialists in those disease states often don't have any conversations with their patients about their oral health. And I wish that they would, as kind of part of their workups, whether it's at the acute or the chronic side.
Well, it's just not the physicians that are doing this. So we had a patient come in the other day, and he had some very extensive jaw surgery, gum surgery, and it cost a lot of money, and it was very, very painful, and the results were minimal. And then we tested him for the bacteria, and he can do all the surgery once in his mouth until he eliminates that bacteria. It's just going to come back. So it's not prevention at all. It doesn't make any sense, to be honest.
Common sense, I think sometimes. And then your Scylla test, tell us what the difference is with that one.
So this one's looking this is a screening test. So this one's not as scientific, but it does give us a snapshot of what your mouth looks like. So this one, carcinogenic bacteria, that's the bacteria that causes tooth decay. So more diet related evaluation there. Acidity, we know that carcinogenic bacteria releases acid. That's also going to help us determine if you're at risk for tooth decay. But you can have high acid if you have GI issues or sleep-related breathing disorders. If your buffer capacity is down, you cannot neutralize that acid. And so we want to make sure that you have a very high buffer capacity. So if you do get some acid in your mouth, that your saliva is able to neutralize that. Blood leukocyte protein, and ammonia, those are all markers for gum disease. And so if those are high, those are also another reason why we would want to test a little bit further to see what that bacteria is looking like.
And I also agree with that, especially on the acidity side. Even just a basic comprehensive metabolic panel test the carbon dioxide, and I see that low in a majority of my patients who have mold, mycotoxins, Lyme, environmental toxicities, and that's because their whole system is acidic, and it's difficult to treat on that level as well, because you have to fix the underlying cause. Things that buffer acid, such as bicarb, even when we give that to those types of patients, it really doesn't make any difference in those numbers until we start treating, that root cause. So if the root cause is in the mouth, we need to get that fixed for them. And the mouth acidity is probably a reflection of some of these other things that I'm seeing on my side.
Yeah. Okay. A lot of people are afraid to go to the dentist, so we try to make it as comfortable for our patients as possible. Dr. Grabiak is one of the few dentists certified in Colorado to do minimal sedation. So we do have that as an option, but we do try to work with the patient, and our appointments are scheduled where he sees only you one at a time. He's not going to be jumping from chair to chair, like they do in traditional dentistry. Our time is specifically allotted for that patient at that time, and you'll have our undivided attention so we can make you as comfortable as possible.
And you're using CBD?
We have used CBD. If I'm going minimal sedation, usually I'm using a very small dose of a narcotic and a benzodiazepine. But we've used CBD before. It's
Awesome.
just not as effective, to be honest.
Yeah, I can see that. Or just more on like calming a little bit of the nerves. It is people are very sensitive about the dentist they see, and that whole being nervous about having anybody touch anything in their mouth. So having, being able to know that you can have sedation, or, just knowing you guys and from this video that when they come, that it's going to be a calming environment for them, as much as possible, so that we can give them what they need and not distress them emotionally while they're getting their procedures.
Yeah, I think that's one of the reasons why we created our new patient experience, how we did, because at your first appointment, it's just to get to know you, just to collect data. We're not actually going to be doing any restorative care or preventive care at that first appointment. So you're not going to get your cleaning the first time you see me. We really want to get to know you, collect all of our data, have time to sit down, evaluate it all, and then make a really good thought out treatment plan. So we do spend quite a few. The first appointment is an hour long. Dr. Grabiak invites the patient back for what we call a review of findings. That's going to be about a week or so after that appointment. He'll sit down with the patient and go over all the data we collected, what his recommendations are, and have time to talk it out with the patient.
So the whole practice is built on explaining it to the patient so that they can understand what the problem is and why I'm suggesting any therapies. Because ultimately, the less dentistry I do, the better for the patient. Okay, we really try to minimize what we're doing. Okay, we're trying to get them healthy. It's all about health.
I love that. And I can attest, I've been in Dr. Grabiak's office with my parents, and how much, really good detail, care, and time that he does go over explaining all the options that are available for you in after they've done their evaluation and presenting the information to you that they've collected.
Thanks, Leah.
So I think we had a few questions sent in before the meeting. I have one here that says, I've been a grinder my whole life, about 8 years. My new dentist noticed this and recommended a mouth guard for my lower teeth. Up until this point, I've had multiple crowns and a root canal. They believe most of the crowns were a result of grinding.
I think that's a perfect example of why are you grinding? Okay, so we need to figure that out. So that's the first thing. And so people are grinding for different reasons, but many of them are grinding because there is a sleep problem. There's a sleep disorder, so we need to figure that out. So we don't do bite appliances on patients, or very few of them who we know are grinding until we do a sleep test, because we're trying to find what the problem is. What's the root cause of the problem?
Yeah, Leah, we used to think that grinding was subconscious, and we didn't really know why people were grinding. We thought maybe it was stress induced or subconscious. But now we're finding out that it's not so subconscious. It's more so your brain telling your tongue, hey, move out of the way, I need more oxygen. And so if we can get a sleep test to prove that, then we can get you in either the right appliance or get you the right airway therapy that you need.
Perfect. I get this. I try to explain this to a lot of people. they get put in some kind of mouth guard, right? That just sits on the teeth. And yes, it protects the wear of the teeth to a degree, but it's not treating the underlying root cause. And then also, I'm sure you guys are aware that we're finding microplastics in people's bloodstream now. And if you're have a plastic mouth guard and you're grinding that, you are grinding little tiny small air particles of plastic and you're swallowing that, and that's getting into your systemic system as well.
Yeah.
So, yeah, that's true. That's one of the reasons we don't use plastic appliances, and especially the over-the-counter ones, and just they're disaster.
Leah, one of the things that maybe we didn't touch on is, well, if I do have a sleep-related breathing disorder, what kind of treatments are there? And a lot of people say, well, I don't want a CPAP, or I'm not going to wear a CPAP. And though CPAP is considered the gold standard for treatment, there are other options for treatment that are very good. And we offer quite a few different treatments in our office, from mandibular advancement appliances to laser therapies, myofunctional therapy. Depending on the patient's needs, we can go all the way to stimulating those stem cells so we can get more growth. So there's
I think
options.
that's important. I'm glad you touched on that, because those CPAP machines are cumbersome. They're definitely not sexy when you're trying to hang out with your partner a little bit. And they also contribute to bacteria, right? Because they're very hard to keep clean. And so there's a risk, if you're not being vigilant about cleaning those things, there's a risk that you're circulating bacteria and mold, which is one of my favorite topics, back into your body with your CPAP machine. So I think people don't understand that there are other options out there. Would you touch on that mandibular kind of reconstruction?
Yeah, it's actually a new technology called epigenetic orthodontics, and it's designed to stimulate the body to produce stem cells while we're doing expansion of the maxillary arch. And when the maxillary arch expands, everything expands. The sinuses expand, the trachea expands. And so the end result is it's actually potentially a cure for people that have obstructive sleep apnea, because you could do the same thing with surgery, but this is just surgery. It's not surgery by any stretch of the imagination. It's just movements where we're releasing the stem cells, initiating growth.
I find it really fascinating, because a couple years ago I went to AAOT, which stands for the American Academy for Ozone Therapy, if anybody's wondering. And dentists are the first adapters of ozone before people like me. And a gentleman did a lecture on that, basically, but for children. And at the time I was like, this sounds fantastic for people who have TMJ, and other options. But at that time, and I think that was maybe 3 or 4 years ago, he said there was not an option like this in adults. You had to start this and do it in children. And I love that now the information and the science has advanced far enough that something that sounds fantastic actually is, and we can offer that to adults now.
Well, we are not, we're an adult-centered practice, but we offer therapies that expand the airway for kids, because it causes so many problems for the rest of their life if they have a small airway. So the Vivo system's fantastic, and so we offer kind of for kids as well as for adults.
And can you go over some of the symptoms that like a parent might see that would indicate that their child would need to be looked at for something like that? Because I think it's not your standard, toothache or crooked teeth. It's a little bit more behavioral things and things like that, correct?
Everything from ADHD to bedwetting to behavioral problems at school. And it's endless. the amount of things that can be affected by not getting a good night's sleep. So,
So if
Yeah,
we have a parent who has a kid that may have some behavioral problems or slipping academically in school, and they've seen, they're going to psychiatry or whatever, and maybe they're getting a little bit better, but they're not really 100% better where the parent thinks that they should be. This would definitely be something that we should have them explore as a possible cause for those types of things.
the amount of problems that not getting a good night's sleep is just unbelievable. Okay, so, and that's usually a source problem. So that's an easy fix because it just takes time.
Awesome. Well, I think we have another question here. When my health got bad, I noticed my teeth became more brittle. Is there any way to reverse this or keep them from chipping while I'm still in the process of healing?
That a great question, and yes, there is. I don't know what the problem is. Okay, so you've got to go through testing and through identifying examination, what the problem is, and then we can come up with an appropriate therapy for it. But yes, it's definitely treatable.
So there could be a lot of problems, right? It could be medications they've been given. It could be an airway sleep issue. It can be bacterial overgrowth as well.
yeah.
All
I
of those things.
are part of that. When we could do a lot of things topically or restorative procedures in office, but we always have to remember that health starts from the inside. So a lot of it has to do with nutrition, diet, exercise, inflammation, all that plays a big role too. So that
And
there's a lot there that we gotta look at.
I want to just reiterate what I think what you guys are saying, and I have this philosophy too that we want to test, not guess, so that we know what's going on with you as the patient, and we can give you the best therapy options available for what we know is going on, not what we're guessing is going on.
Right.
So let's see. When my teeth got bad, I noticed they become more brittle. We talked about that. And then what are your thoughts on Luminex? Luminex, the brand for teeth whitening.
These are whitening strips. They're just over-the-counter whitening strips. There's some good ingredients in there, the coconut oil and the sage oil, the lemon peel oil. Those all might get you minimal whitening results, but everybody's different. So it kind of depends on what you're looking for and how drastic a change you're wanting. We do offer whitening procedures in our office that are safe for the teeth and the enamel. But if you're looking for something minimal, like a minimal change for some extrinsic stain, it might be fine.
This is another.
Oh, what is it? How to reverse or at least maintain current level of gum recession? There's a lot of different reasons why gum recession happens, so we need to do an examination to see what the cause of the gum recession is first. A lot of it is bacterial, so we need to test that bacteria, but gum recession can also be functional too. How's the bite? Are you grinding or clenching? How your teeth come together. There's a lot of different reasons why recession happens. So we just really got to figure out what that root cause is first.
And in gum recession, the standard of care traditionally has been like surgery, right?
Yes.
And I think I've heard you all say before that in your practice, you have been able to reverse that in a lot of patients without sending them for surgery by treating the underlying cause, correct?
Yeah, we do it routinely, to be honest with you.
So I think the biggest thing, if we're coming from a holistic point of view, surgery is not holistic. And so if we can avoid surgery, then that's what we want to do.
Yeah, I believe that same thing as well. So, sir, if you go to a surgeon, they're trained to do surgery. And so, most likely, the recommendation you're going to get from a surgeon, and no one is saying that that's bad per se, is typically going to be to do surgery. So, I do, in any case, whether it's your dental health or your physical health, I always recommend getting a second opinion for that reason.
And there are occasions, when we do have to refer our patients for surgery, sometimes we just need to do that. But we do it less and less now. And if we really are addressing the root cause, what's probably more telling with gum recession is that there's a reason. If there's no gum there where it used to be, that means there's no bone underneath there either. And so when we look at gum recession, it's not just gum recession, but that bone is receding as well. And so we need to really dig a little bit deeper, see why that's happening, and see if we can prevent it from continuing.
I agree. Do you take insurance or reimbursement for services?
We bill insurance, and so if a patient has insurance and they can go out of network, they can get reimbursed for their services, for our services.
And you also take Medicare for certain things like your cone bean is that correct?
Yeah, some Medicare plans do offer out-of-network benefits, so if theirs does, we're happy to do the billing. We have a great operations manager and office manager, Jeremy and Noel. They are happy to work with our patients with all of the insurance billing. We also offer care credit for patients if they need some sort of payment arrangement. But we do our best to work with our patients for sure.
I hear you. I think this is one of the most difficult conversations to have with patients, and one of the things that I try to reiterate, and the same in this dentistry world, is if you kind of take the hurt up front or you pay up front to get everything fixed and worked out from that root cause, you're actually going to end up spending less money over your lifetime in health treatments, not only dental treatments, but health treatments related to your dental health. So sometimes it does seem like a big chunk, and everybody has a budget, but I do encourage people to kind of think about that big chunk. You're either going to pay now or pay later. And if you pay now, usually the total cost is going to be way less than if you wait to pay later.
Yeah, definitely.
Can you all suggest a certain toothpaste and or mouthwash? You guys have some brands you like?
Yeah, we really like Risewell toothpaste because does not have fluoride in it. It's got all natural ingredients, and it has something called hydroxyapatite, which is a natural occurring substance in your tooth enamel as well as your bone. So we're big fans of that. And over-the-counter mouthwashes, we do not recommend. They can do more damage for various reasons. They can eliminate the production of nitric oxide. And so we're not big fans of over-the-counter mouthwashes. We do on some areas use a couple products, but we're using them less and less.
And for those of you, nitric oxide is very, very important to your cardiovascular health. So we do not want to eliminate that. And the majority of it is made in your mouth, correct?
Yeah, it's made in the up in the nasal cavities in the back of your throat. So if you're mouth washing, you're potentially reducing the amount of nitric oxide you can produce.
And tongue brushing does that as well, correct?
No, tongue brushing, no,
Does
because
not reduce nitric oxide?
you will get some of the stuff, but it's not killing all the bacteria. So
Okay,
there's a difference on that. So it's
that's good to
eliminating
know.
odors and things like that from the tongue, but I don't believe it's taking care of the bacteria.
Perfect. Now, over-the-counter mouthwashes you don't recommend, but mouthwash like from Rinsewell or and more holistic, are those okay to use on a regular basis or not, or more sporadically?
I always want to take a individual approach. So there's different kinds of mouthwashes out there for different kinds of things with different ingredients. And so we want to make sure that if you do want a mouthwash or you need a mouthwash, it has the right ingredients for a specific situation that we're trying to address. Um, there are some, Rise Well has their own. We use tooth and gum tonic in our office as well on occasion. But we want to really make sure that we're not just saying everybody should be on this or that, because we really want to make sure that the products we are using are specific to that patient, and we're not just using a product to use it, but that we're actually using it to create a certain effect.
And so that kind of goes back to, we want to treat the root cause, because if we work on that root cause, we may not need mouthwash, right?
Right.
Exactly.
Awesome. Okay. Do we have any more questions?
Looks like there's a couple things in the chat. Let's see here. Oh, maybe that's it.
I guess nobody's particularly chatty today. Let's see, Giselle, do you want to unmute some of the people to see if they want to ask any questions?
Hi, everyone. Everyone is allowed to unmute themselves. If you have any questions, you can unmute yourself now.
Yeah, if anyone has any questions going forward too, we can always give our office a call. You can talk to any one of our staff members. Everyone's all well versed in the services that we offer. We're happy to talk with you if you even have any questions about what does the new patient appointment look like, or you have a question about your health. They'll guide you kind of in the right direction of what's the next step. Our website's also really awesome. It has a lot of good information on there.
I put your website in the chat box, and if they're a new client and they want to book with you, can they book from your website, or is it better to give you all a call?
So we always tell patients to give us a call first. There's a lot of things that we like to go over before we set that appointment, just to make sure that expectations are met. And so, yeah, if you just give us a call, Jeremy or Noelle's happy to go over a few things, and then we'll get that scheduled.
Well, awesome. I think you guys have provided us with a wealth of knowledge, and I really appreciate your time and energy and making this presentation and helping us inform my clients as well as everybody else out in our community. And do you all have any last parting words of wisdom that you'd like to let people know before we log off tonight?
Thanks for giving us the opportunity to present what we had to say. But we're just really big believers that you have to personalize the healthcare, and it's about health. And it's not in a vacuum. Okay, the mouth is not in a vacuum. It's part of the overall body.
Well, thank you for that. Thank you for all your time, energy. I so much appreciate it. And as you know, I will continue to send my clients to you because I believe in what you do, and they do have great outcomes with you. And I think together, when people are focusing on the oral health as well as the body, nothing happens in isolation, and we have to look at people as a whole person. And I encourage you as an individual to look at yourself and treat yourself as an individual, and ask questions and seek answers to the things that are going on with you to improve your health. And thank you for joining Mountain Roots Holistic, or up to say holistic healthcare. I was almost ready to say holistic dentistry because we've talked about that so much. I'm Leah Hughes, a nurse practitioner here. You can also reach us at mountainrootshh.com or info@mountainrootshh.com. And we see patients in person or via telemedicine. And thank you, Dr. Grabiak. And thank you, everyone who's participated. You guys are such a wealth of knowledge. I'm about to come over and pick your brain with some more questions here. I know we've talked a bunch today, but I have more. So have a great evening and thank you.
Thanks, Leah.
Thanks, Leah.